Georgina with the Association of British Paediatric Nurses, and today I'm going to be talking to a children's nurse. We're going to talk all about their life and their experiences of being a children's nurse. I hope you enjoy the video.
Hi, I'm here today with Katie Anderson, who is a children's nurse, and I'm going to be asking her all sorts of questions around being a children's nurse and another exciting layer to her career that she's got as well. So welcome.
Nice to be here. Thanks for inviting me along.
So are you currently a children's nurse or do you work in another field?
So I am a registered children's nurse and still am very much an active member of that community. However, I'm not an acute practicing children's nurse, if that makes sense. So a lot of people think, oh, if you're a nurse, then you must work within the community or in a hospital somewhere. I work within the education sector.
And how long were you a children's nurse for before transitioning to the education side?
Oh goodness, I'll have to think back now. So I started my training back in 2007, did a 3-year undergraduate, and I specifically chose children's nursing at that point. So you can choose adult mental health, CYP, or children and young people, or learning disabilities, and I knew from the get-go it was children's. So undertook that, and then finished 2010. Goodness, it is that long ago now. And then my first post was my background's operating theatres. I had a placement during my undergraduate programme and absolutely loved it. I mean, I enjoyed all my placements, but that one I think particularly stuck with me. And then that has where been my career thereafter. I transitioned over into higher education in 2017.
Right. And you said you knew straight away that you wanted to be a children's nurse. What was it that just called you to that?
Yeah. So I think a lot of people think, oh, as children's nursing, you are just going to be looking after small babies and little toddlers and, those possibly within the primary school age range. But that's absolutely not the case. So with children and young people, you're looking, dependent on where you're working, but you could be looking after children from premature or preterm, all the way through up to the age of 18 and sometimes 25 in some cases, depending on where you're working. So it's young people, and I think that's really key. It's not just children's nursing, it's children and young people to look after those, but also predominantly in our role is actually family-centred care and family integrated care. So any child that comes along, they will always be with an adult of some, it doesn't necessarily be the parent either. And I think that's something that opens people's eyes. Is society's expectation is that mum, dad, and then there's 2 children, and that isn't the reality of how things look nowadays. So you've got foster families, you've got adoption, you have same-sex couples, the step mums, stepdads, grandparents. There's a complexity in that, and actually I think that's the draw, is that's family, and family means different things to different people.
Yeah.
So it's and it's looking after the child in that family and supporting that family in whatever circumstance. It could be very acute, you've popped a bead up your nose, for example, that the child is otherwise well, but then to the more extremes with those with long-term conditions. And I think that's the complexity and the variety in children's nursing, is that not all children are unwell. I think we almost sometimes focus on an unwell child. Actually, there's very many well children, but they come into our care at some point.
Yeah.
So there was the variety for me, and that's why children's nursing. The other thing is my mum was an adult nurse. She was a district nurse. And I heard some of her stories and I was like, not sure I want to look after her. Yeah. But I think it was just the variety that you could see, and actually the impact that you could have, and whether that was the impact on the child or young person, but also the family within that.
Yeah. So what's your favourite part of being a children's nurse?
Oh, I think loads of things. I think if I'm referring back to when I was in clinical practice, very much the favourite thing is, one, the interaction, the fact that you need to adapt your skills dependent on the child or individual or family. Your communicational skills. So your communicational skills could be using Play-Doh. and playing. And I don't mean play as in play. You know, there's a lot about actually therapeutic play. And that's in the adult sector as well. So really truly understanding what play is and the impact that can have. To then changing your communication to talking about the latest movies, to then keeping up to date with the latest video games. There's so much. But also seeing that journey. That was kind of my favorite thing, was seeing a journey. And I think when I was in my training, I very much got to see that. But unfortunately, through working in operating theatres, I sometimes didn't get to see that journey. And I took a while to process that. Actually, I was just a chapter in that big book, in that journey of that child. And often they didn't get to see me. You know, I'm behind the closed doors. I was, you know, predominantly scrub side. So the family and child never saw me. And actually, that's what really sparked me being in operating theatres, is I needed to be that advocate for that child and for that family. And you know, that child at that time didn't have a voice. So I needed to make sure that everything was being done correctly, everything was done safely, everything was done to the best of our ability. And, you know, a dressing was put on correctly. You know, was that the right colour of cast that they had asked for? You know, if we were fixing, you know, it's those small things, but actually they make a massive difference on the other side. And for those then children's nurses in the ward to then pick that up from there. So I think clinically that was my favourite part. But that's no longer my role. And I think I am still a children's nurse, and I very much advocate for children's nursing, and I support children's nursing in undergraduate. My favourite part now is, again, still that journey. And okay, I don't have patients as such, but I have many students to support through their journey, and to support them from first year, maybe coming from school, maybe from wider reach. You know, they've maybe not studied for a very long time, and to see them coming in. I mean, I've got my first years just now, it's around September time, and it's very exciting. So I just taught the other day, they're getting excited about wearing their fob watch for the first time, or getting their uniform, or making sure that their hair's in the right position, or, you know, all these things are so exciting to then see them as their journey when they're third year going, goodness, I have reflected on this. I feel like I've got the leadership skills now to, you know, manage a bay or to manage a caseload, and to support students through personal challenges throughout that as well. So cost of living, family breakdowns themselves, relationship breakdowns, but how they've then worked their way through that and to manage themselves and look after their own well-being. And I think that's really key, is to manage their own well-being and support themselves prior to then looking after others. So I think if we're saying what's my favourite part, is actually journey, I guess would be the word, in no matter which, you know, concept I've worked in, would be the journey of whoever it is.
That's brilliant. Now, we've touched on it, but you are, let me get this right, Scotland's first children's surgical first assistant.
Yeah.
It is a mouthful, but it is an incredible title. Tell me all about that. I mean, what's involved?
What does that mean? Yeah, loads of people have no idea even what this role is. Exactly. So it's, when I was in clinical practice, I had worked predominantly worked in scrub side. So what we talk about is, you know, behind the anaesthetic doors, what happens there. It's not just a case of counting 5 swabs and having lots of instruments. It's far more than that. But I think that's the perception. And sometimes when you're watching, I don't know, Casualty or Grey's Anatomy, that's kind of the perception of it. So I had worked in there for, goodness, maybe 7 years. And I had got to a point where I was like, I'm getting itchy. I feel like I need to do some CPD. I mean, you always do CPD anyway, but I felt I needed to go back and do some formal studying again. Now, when I had left university, I didn't think I would go back to uni, but here I am, and now I'm not working in it. But anyway, so I was like, what opportunities are available, and what's predominantly within operating theatres, because actually it's a very specialist type of nursing, and there's not a huge amount of development or courses or, you know, things like that. So kind of did a wee bit of a scoping, and very much aware that in England, predominantly in Wales, that they had surgical first assistants. So when you think of an operation, you think of 2 consultants or 2 doctors doing the operations, and that's pretty standard thought. There are those of us that are not medically trained, and we train to support the consultant or doctor to undertake the operations. And I thought, quite fancy that. I think I've got some of the skills. I mean, I know all the equipment, etc., etc. So I undertook postgraduate studies. Was supported by my area and supported by our local children's charity in funding that as well, and undertook that. So I had to provide a portfolio of supporting. Now, this could be from holding laparoscopic instruments, so keyhole surgery, so holding things like that, to preparing the patient prior to incision, making sure the drapes were okay, suturing, so did suturing as part of that. Lots of different advanced techniques, as you would say. And I was never, so what it means is you're not counted in nursing numbers, it's you and the consultant that does essentially the operation. So a lot more responsibility, a lot more taking your head away from thinking about the instruments or what they might need and focusing on the medical aspect, I guess. But at the same time, the role is really valuable because you almost are that buffer between the two. So, for example, some of our new recruits that were into the area, or somebody that's maybe never done this operation before, I could almost preempt as to what we needed. So I could tell the scrub nurse at that point, you might want to get this ready, or we might need this, or we might need that. So they're then able to preempt, and it's a smoother, slicker operation. It's reducing the anaesthetic time, but then it's also at the same time focusing and trying to prepare for the surgeon and support them in that.
Yeah.
I did that for all specialties from maxfax to neurosurgery, orthopedics, ENT, you name it, I covered them all. And that's just probably because of where I work. We covered all specialties. So very proud to hold that title. I didn't know any other children's nurses that held that role. I'm proud to fly the flag for CYP nursing as well. And I think it's not just adults and they've advanced in that, but actually as children's nurses, why can't you go and be the first? Now, if you'd asked me that when I joined university, I come from a very small village. I mean, getting to university was a massive thing. I'm the first in my family to go to university. So that was a massive thing to then say, oh, I've actually developed. Yeah, really proud of that. And I hope that that's inspired some others, to see that and for them to do their development and push the boundaries.
It's an incredible achievement. It really is. And I think it's very inspirational to people to hear that you've done that. And
Yeah.
how do you think it's impacted your nursing career and where you've ended up now doing more the teaching side?
Yeah, I think, well, as I said, I didn't think when I'd get into university, even if I did complete university, I didn't think I would then go back. I've gone back, that sparked that interest and that further study, and that we are a degree, profession, should I say. That then sparked, I did some postgraduate study. That has then sparked me to continue my studies. So I've gone on and done my teaching qualification now. I'm currently in the middle of my master's. So, I never expect to be even thinking about any of that. I mean, I'm even thinking of doing a PhD. I mean, it's so far from where I thought I would ever be. But it's also really inspiring, and I can share that story with some of my students. And it's also not being fearful of that. Go out there, what is out there. At the end of the day, that had a massive impact on patients. So it reduced patient waiting list. So we didn't have to wait on 2 medics to undertake that operation, for example. I was able to do it, so it reduced the waiting list predominantly. So again, it's going back to the impact that has on patients as well. So yeah, I think it's had a big impact. For me personally, it's given me a lot of confidence. So I knew I was good at my role as a scrub nurse. But then how do then I enhance that and further that? And I think it's given me the confidence to go, do you know what? Don't be afraid. Try something new. Go out of your comfort zone. And like that, you might ask that later, but I never thought I'd be in education either.
Yeah.
So yeah, it's having that confidence.
And if you could give advice to somebody who's wanting to become a children's nurse, what would you say?
I get that question quite a lot, especially given education.
Exactly.
How do I get into children's nursing? What do I need to do? My best pieces did you say to get into children's nursing or to be as a children's nurse?
Well, it could be either. If somebody's wanting to be a children's nurse.
Yeah. Best bit of advice with you is to get volunteering. So, and volunteering across the lifespan. So Can you go to some mother and baby groups? Can you go to some breastfeeding, support groups? Can you go to out of school clubs? Can you go to rainbows, brownies, youth groups across the lifespan? Can you volunteer at your local food bank, for example? You're seeing how that impacts there. Some of your GP practices might run some out of our support networks, mental health charities. So it's where are children going? How can you support that, and how can you volunteer with that and getting that exposure? I think for me, it's where possible to get that with that interaction with children or young people. But it's also that you are actually going to have to engage with adults. So any volunteering in a caring sector is beneficial to us as children's nurses. It's understanding how to communicate, how to have that conversation with members of the public. Working in, for example, a supermarket, working on the customer service desk, you're interacting with the public, is gaining that confidence, which is great. But also, if you can then contextualize that into children's nursing, fantastic, and engaging with children. I would also say keep current and up to date. What's going on in nursing? So keep a broad term. I'm saying watch what's in the news. It's not always positive in a frame, and I think it's also being mindful of what the media portrays and actually what is the truth behind some of that. So I'd say be cautious, but at the same time, some of your key players, so for example, Nurse Midwifery Council, your RCN, yourselves, social media, and I think we'll come on to that later on, but keeping an eye out as to what's going on, what's hot topics, what's going on. The United Nations, what are they doing about children? There's lots out there. So I think keeping a little eye on that, as well as what you're actively doing, will set you up in a good stance.
Yeah, that's brilliant advice. And what do you think the future of children's nursing needs to be?
Oh, needs to be or is? Yeah.
Well, what do you feel, would be good?
I think we as a community are a strong community. We have a voice, and I think we need to continue that voice. I think we need to still ensure that we have children's nurses and that we are identified as children and young people's nursing. It is, I think, I have this conversation with colleagues as well, and I think we often get referred to as a specialist. Actually, I have a very different look on that. Nursing is the overall umbrella term, but under that, we're all specialists. So there's adult, mental health, CYP, learning disabilities.
Yeah.
And we're all a specialty in our own rights. No more one than the other. And sometimes we overlap in some of aspects. But I think we need to ensure that we still have our voice, and we have our voices to why what we do is why we do it, and having that voice for those children and young people. So I think that's what we need to do moving forward, is to ensure that voice. But it's also celebrating. Celebrate the fantastic work that children's nurses and young people nurses do across the country and beyond. So we're not very good at doing that as nurses. We're very good at saying what we can do better, or this didn't work out, etc., etc. But we also need to celebrate.
Yeah.
Of the fantastic work either individuals, teams, trusts are doing, to share that knowledge with others, as well. So as universities, we touch base with what are you doing? What are you doing? Oh, that's really interesting. I'd like, can I hear more about that, for example? But also, in my role is, I support students when they're out in clinical placement. They'll come back and they teach me.
Yeah.
And that's how I keep up to date. I'm not clinical anymore. They've told me about this new dressing, for example, or this new paperwork, or this new initiative or quality improvement that they're doing. So it's constantly developing and improving that care that we're doing. And it's having that passion to ensure that it's family centered or family integrated. And I think that's different to say some of our other specialists in the field.
Yeah, I think it's really important. So when things are hard at work, what keeps you going?
Yeah, I think it's just being open and honest with others. And I find this particularly challenging, or at times I have students disclosing quite challenging things that are going on in their personal lives. And I think we're all human, and that we actually want to fix things, and we won't be able to fix everything. It's how you then support them and signpost them through that. But that does have an impact on you, and there's only so much empathy and compassion you can take. And in literature, and that's currently studying just now, there's compassionate leadership, and we naturally are compassionate in nursing, but actually you can get secondary compassion, and actually you're compassionate for those that you care for, but then it's also the impact wider than that, and you can become compassionately fatigued.
Yeah.
By being too caring all of the time. And actually, how do you then manage that? And I think it's ensuring simple basic things. Are you having a lunch break? Are you having a tea break? Simple basic things. Are you finishing on time? Can you try and finish on time? Can you do something for yourself in the evening? Now, it doesn't need to be massive. It could be just running a bath. It could be cooking something lovely, but people think that's also you being selfish, but that's absolutely not. It's you filling up that battery and making sure, and as I say this often to students, to be an effective, really good nurse, you have to be able to manage self and look after self before you can then look after others. And if you at some point are fatigued or unwell, you need to take that time out to look after self before you can then look after others.
And would you encourage others to take up children's nursing?
Oh, 110%. I have absolutely never regretted my choice. If I'm being honest, I actually applied for architecture and nursing.
Oh, okay.
Yeah. So I loved drawing, loved dots, numbers, precise things. So between the two, but I do not regret it for one instant. Like I said earlier, one, lucky to get into university, two, to pass, to then go and undertake a career that I absolutely loved. I didn't leave my clinical job because I didn't enjoy it. I saw an opportunity, and actually the reason I came over here was I contacted my local university to say, do you want some help with some clinical skills that you undertake? I came over supported with some skills. They then told me there was a part-time job going up. Me, lecturer, like that role is imposter syndrome. Never, in the first instance, applied for it, got it. 6 months later, I'm here full time. And again, never regretted it. And it's a different part. So I think when you first go into your nursing, it's so rewarding. You're engaging with individuals and families, and you get that instant reaction, and you can see that you've made a difference at that point. Potentially, it could come later on, or just even that conversation. But you do not know where your career is going to go. And if you could have said, Katie, did you ever think you're a lecturer? Oh, no, I still laugh sometimes now when people go, where do you work? And I think it's taken me a long time. So I know a lot of my colleagues, when people ask, oh, what do you do? They say, oh, I'm a nurse. And I go, all right, whereabout do you work? Do you work in the hospital or community? And they're like, oh, no, I work at a university. And they're like, oh. And so I for a long time struggled with saying, actually, I'm a lecturer. Yeah. I'm a nurse academic, and it's just a different route. It's almost like instead of working in a hospital, you've got all the different wards. I just work in a different ward, for example.
Yeah. And it's such an important job, we couldn't do without it.
We are our future workforce. We are trying to demonstrate the gold standard of what should be out there to, question students, to engage with students, to push them to their full potential, but allow them to also go out to practice, to question in a healthy way. Why are we doing this? Oh, actually, could we think about doing this a different way? Or, oh, I heard that Katie was this first surgical first assistant. I would like to become one of those, pushing those boundaries out there. So, yeah, I think you'll never know where your career is going to go. And that's quite exciting.
Yeah, very.
It's really exciting. But you're always inside. I'm a little flying that flag. I'm a CYP nurse at heart.
Yeah, I love that.
Thank you so much for watching our video. I've been Georgina with the Association of British Paediatric Nurses. If you enjoyed our video, please give us a like and subscribe to our YouTube channel. And if you have a question you'd like to ask a paediatric nurse, pop it in the comments below and we'll see if we can ask it in one of our videos. Bye!